I'm going to tell you the homeopathic medicines that you can use for the treatment of COVID-19, and we are starting right now. Hello everyone, my name is Dr. Taha Khan. Welcome to my YouTube channel where I share with you clinic and exam related productivity tips and strategies. If this is your first time here, start now by subscribing and hit the bell icon so that you don't miss anything. COVID-19 is a highly infectious disease which is caused by the novel coronavirus. The affected person may experience mild to moderate or even severe respiratory illness as the virus primarily affects the lungs. The common symptoms may include fever. There may also be dry cough and breathing difficulties, which is actually alarming in the newly mutated variant. Other associated symptoms are muscle aches, chest pain, nasal congestion, running nose, sore throat, nausea, vomiting and diarrhea. There may also be loss of smell and loss of taste sensation. Among the clinical presentation of COVID-19, the patients who are infected with show a wide range of symptoms, and sometimes it gets difficult to detect the disease at an early stage based on the symptoms, as the RT-PCR tests are showing false negative results. Now, I have already made a video on why the RT-PCR tests are showing false negative results. You can watch the video by clicking this I button. You will also find the link of that video down in the description below. Also in blood test, typhoid is detected positive due to cross reaction. Initially the symptoms are mild, but some patients may progress to severe disease including pneumonia, respiratory distress and eventually death. What the records are showing is that 98% of the patients will experience fever, 82% of the patients will experience cough, fatigue in 70% of the affected people, 55% will have shortness of breath, 44% will have myalgia, that means muscle aches, and 33% will experience sputum formation. Now let us see the few risk groups of COVID-19. So the patients who are having any of these are in a very high risk of acquiring the infection. Firstly, if the person is having any pre-existing serious illness such as diabetes or hypertension or kidney disease or any respiratory illness. Secondly, pneumonia of high severity. Thirdly, if the chest X-ray is showing radioopacity and pulmonary infiltrates. This is something that you must consider in the basic diagnosis these days, even when your RT-PCR is showing negative result. Number 4 is old age group. And number 5, lastly, is the immunosuppressed underlying medical conditions, or if the person is under immunosuppressant medication. Now let us see the homeopathic approach. So these guidelines are strictly suggested by the Ministry of Ayush Government of India. In epidemics and pandemics, the first approach should be to follow preventive measures and strengthen immunity. So the committee of experts in the Central Council of Research in Homeopathy, New Delhi, after sufficient evidences and thorough research, issued a notice and announced the homeopathic remedy arsenic album 30 as the immunity booster against COVID-19 infection. Thereafter, arsenic album 30 was widely distributed among the people by the doctors and government officials. The next approach is to provide the homeopathic supportive symptomatic aid to the infected people. Homeopathy has been useful in many infectious diseases such as influenza, dengue, acute encephalitis syndrome, etc. And preclinical studies have shown the immune enhancing potential of homeopathic medicines. So homeopathic medicines can be advised as an integrated treatment along with the necessary conventional treatment. Now understand this, homeopathy is a holistic system of treatment which is also the second most used mode of treatment in the world as per WHO. In homeopathy, the treatment is based upon the presenting sign and symptoms of the patient. So two persons suffering from the same disease, say tuberculosis or even COVID, may require completely different medicines. So there are no disease-specific medicines in homeopathy. So the medicines that I am suggesting here are based on studies, uses and my experiences of treating COVID-19. Now remember, the homeopathic treatment should be used as a supportive aid to the COVID-19 patients with the permission of the health authorities and the willingness of the patient. So the first medicine that I am going to mention is Brainia alba. Brainia alba is a wonderful remedy in homeopathy known for its healing properties in respiratory illnesses. When there is dry cough plus stitching pain in the chest, Plus, there is also dryness in the mouth and throat, so that the patient wants to drink water every now and then. The patient feels better in open air or near a window and dislikes the warmth of the room. The patient may sit up at night on account of the severity of cough. Respiration is difficult and quick, and the patient wants to take long breaths. Also, there will be aggravation from motion, so that the patient doesn't want to move at all. The patient will only want to sit still. The next medicine is Gelsemium sempervirens. The most important symptom that will indicate Gelsemium is if there is great prostration and debility. There will be slow breath plus extreme prostration. The cough will be dry, the chest will be sore with fluent running nose. The spasmodic pains in the chest can be eased by this remedy. So if there is dizziness, drowsiness and sleepiness along with all these symptoms, means cough, chest pain or running nose, then Gelsemium will provide relief and will increase the recovery rate. The next medicine is Arsenicum album, which has also been used as an immunity booster since the COVID-19 outbreak. Although it can also be used after getting infected with COVID-19 if the symptoms of this remedy match the symptoms of the patient. Patients where you can prescribe Arsenicum album will be fearful of his illness. There will be fear of death. Along with this fear of death, there will be breathing difficulty, which will be aggravated at night and on lying down. So the patient will not want to lie down and will always want to sit up, and breathing will get better on sitting up. There will be midday and midnight aggravation of the symptoms. Clinically, on a stethoscope, a wheezing means whistle-like respiratory sound can be heard. And predominantly, if the right side of the lung is affected, then this remedy will be helpful. The next medicine is Eupatorium perfoliatum. General and severe bone pain is a must to prescribe this medicine. If this is present along with fever, means the patient will say it feels as if all the bones in the body are broken, or it feels as if the bones have been dislocated, then give Eupatorium. Another very important symptom to look for is chill during fever. There will be chill, and during this chill stage, there will be insatiable thirst for water. The symptoms are worse at night, and the patient gets on his knees and hands due to respiratory difficulties. So that was Eupatorium. The next medicine is Belladonna, which is one of the topmost fever remedy. When there is congestion in the face, how will you notice it? You will notice redness in the face, in the throat, the tonsils will be inflamed, plus high fever. Your medicine is Belladonna. More confirmed if before the fever there is any history of exposure to cold air like AC, or cold air from the window, and there may also be pain in the throat. So if you get these combination of symptoms, then Belladonna will definitely help you. The next medicine is Carbovage, and Carbovage is also known as the last aid drug in homeopathy, as it has the potential to relieve patients from life-threatening illnesses. There is this sensation of air hunger, you see, where the patient feels as if he or she is unable to breathe properly with the doors and windows closed. So the patient wants to be fanned constantly, so as the breathing may become easy. Very striking symptom among the COVID-19 patients. And along with this, if you have eructation, belching and gas formation, then Carbovage is your go-to remedy. The next medicine is Aspidosperma, and you must have definitely heard about this medicine. Everyone was sharing in social media. And I want to clear this one thing. There is no conclusive proof that taking this medicine will increase the oxygen saturation. It's all rumors. Do not believe it. Yes, this is an excellent medicine in cases of breathing difficulty, where there is asthmatic type of respiration, with want of breath during exertion, during slightest of exertion, like walking from one corner of the room to another. So if this is the condition of the patient, give this medicine in mother tincture, 10 to 15 drops twice or thrice daily, depending upon the severity of the patient. But do not give simply believing that it will increase oxygen saturation immediately. The next medicine is Justitia, and it is another prominent respiratory remedy in homeopathy. It is highly efficacious for dry cough plus painful throat, preferably in cases which began with sneezing and nasal discharge, which gradually descends to throat and chest, causing cough and dyspnea. Plus, the patient feels tightness across the chest. Along with this, there may be loss of smell and taste. Another very helpful remedy that you can use is Aconite, which I had taken when I had COVID last year in October. What had happened is I had slept one night with the AC turned on, It was hot during that time and the AC in my room is just beside my bed where I sleep. The next day when I woke up, I started having this cold sensation. And by noon, I had already developed high fever. So I took aconite on these two remarkable symptoms. One was the cause, which was exposure to dry cold air. And the second one was the suddenness with which the symptoms developed. Of course, I had to take few other homeopathic medicines in the next few days as per my symptoms, which kept changing, and finally got cured of homeopathic medicines. So if you find these combination of symptoms, then you can use aconite as well. So these were the homeopathic medicines that you can use in case of COVID patients suffering from mild to moderate complaints. You can expect good relief in mild to moderate cases. In cases of severe complaints, do not shy away from using homeopathic medicines along with allopathic medicines. Both the pathies will do their own part. Don't be adamant on this, because during such cases, saving the life of the patient is more important than saving your ethics. Let me know how you like the video. Give it a thumbs up if you liked it, share it with your friends, and I'll see you in the next.